Welcome to today's webinar on the overview of the new regulations in place for personal services. My name is Isaac Reichman. I am the Director of Public Information at the City of Chicago Department of Business Affairs and Consumer Protection. A little bit of housekeeping before we get started. If you have any questions, I do want to make sure to take the time on today's 30-minute webinar to answer those questions. So please, if you have any questions, I'll pause a couple times throughout this presentation and then also hopefully have time at the end. Please submit those questions via the chat function. I'm going to type into the chat right now so you know where to send those questions. Please again use the chat function. You'll notice there's a Q&A and a chat function. The easiest way to get for me to see your questions is to use the chat. Additionally, you'll see at the bottom of every page an email address. I'll type that into the chat as well. That's BACP outreach at cityofchicago.org. If for whatever reason I do not get to your question or I'm unable to answer your question during this presentation, please follow up with an email. Again, that's BACP outreach at cityofchicago.org. For some questions, I may need to consult with other departments, other experts around the City of Chicago. So again, if I do not get to your question on this webinar, please send an email and I will respond, or someone from my team will respond as soon as possible to your question. This webinar will be recorded and it will be posted to our website, to that same site that you used in order to get onto this webinar. That's chicago.gov/business-workshops. And I just typed that into the chat as well. So again, this webinar is being recorded and it will be posted to that website and to our YouTube page, hopefully by tomorrow. So, as I said, today's webinar is all about the overview of the new regulations that were announced on Monday for personal services. So an agenda for today's webinar. First, I'm going to provide an update on data. The health metrics that have been the city's guideposts and North Star throughout this entire time. Then I'm going to talk about the new restrictions that are in place. And they're pretty straightforward for personal services, but I'm going to talk about them and answer any questions related to them. Then I'm going to provide an overview of the entire Phase 4 guidelines as a reminder for personal services. And then finally, I'm going to talk about enforcement and operational requirements. Again, if you have any questions, please do not hesitate to submit those again via the chat function. Do not use the Q&A. So, as I said, before I get into the specifics of the new regulations, I wanted to take a minute to take a step back and talk about the health metrics, to talk about the data for the City of Chicago related to COVID-19. Because even as we moved into Phase 4 back in June, and throughout this time, throughout everything we've talked about related to this, we want to make it clear that we are by no means out of the woods when it comes to the COVID-19 outbreak in Chicago. As you can see from this first graph, we have done, we have made significant progress bringing our case rate down from its peak back in May to what we are seeing now. However, you can see that particularly since the end of June, we have seen a rise in cases in the City of Chicago. We're still nowhere near what we were at our peak. And we're not seeing a spike that we're seeing in other states and other cities, like in Florida and Arizona. We're not seeing a spike like we are there. However, we are seeing a rise in cases that we have specifically seen, especially over the last 2 or 3 weeks. I encourage all of you to visit chi.gov/COVID-. You'll see it on the bottom of this page. I will also, again, type it into the chat so you see it. That we are, I encourage you all to visit that. It's updated daily. I check it every day. It's updated by the health experts from our health department. with the most up-to-date rolling average for case rate, for cases, for deaths, number of people tested, positivity rate, things like that in the city of Chicago. And as you'll see on that second row right there, we are over that 200 threshold. That's been the threshold that the health department and the mayor have used to kind of indicate that we were ready for phase 4 when we went below 200. But since then, our case rate has gone up to over 200 cases per day. And because of that, because of this spike that we have seen, the health commissioner and the mayor have indicated that we do need to make some changes to our requirements, specifically to minimize those cases, those incidents in which individuals are in close contact with other people, specifically when they're not wearing masks. So I do want to make clear we are still considering this phase 4 for the city of Chicago. We're still in that gradually resume phase, which means the goal of this is to continue reopening Chicago, but ensuring the safety of residents. And we've said since the beginning of phase 4, really since the beginning of reopening, that our goal is to ensure the safety of residents. And we may, as we announced on Monday and will come into effect tomorrow, we may have to continue making changes to phase 4 in order to keep people safe. So with that in mind, what are the new restrictions that are in place effective tomorrow, effective basically at midnight tonight? I'm going to go over all the 5 main new changes. First, indoor service is no longer allowed at any establishment that serves alcohol without food. So bars that serve alcohol only will need to close indoors. Table seating at restaurants, bars, and other similar establishments limited now to no more than 6 people. And then the focus of today, personal services may no longer offer services that require the removal of face coverings. Health and fitness centers may no longer offer classes with more than 10 people. And then property managers are asked to limit guest entry to no more than 5 per unit to prevent parties. So before I get into this in a little bit more detail, we understand, health department understands, the mayor's office understands that these restrictions are a challenge for businesses. But we also need to make sure that the decisions we make are all entirely based on the health metrics and on keeping our community safe. So the health department has identified the need to roll back some of these guidelines in order to keep our community safe. So what is included in personal services? Again, these are hopefully understand and know what are considered personal services at this point. Beauty salons, nail salons, tanning salons, wellness places like day spas, massage establishments, saunas, hairstylists, barbershops, etc. And then other things that fit under that personal services, ear piercing services, tattoo parlors. So again, effective tomorrow, the personal services may no longer offer services that require the removal of face coverings. Again, spas, hair salons, barbershops, massage establishments, tattoo parlors, any establishment that provides personal services. And so face coverings truly must be worn at all times by employees and customers. Now I'm seeing a couple questions come in related to the why this is in place. And I'll talk kind of at a high level, but I'll ask that you please submit that question to our email, bacpoutreach@cityofchicago.org. And that's because I want to make sure that, I'm not the health department, so I cannot speak specifically to outbreaks, things like that. But I do know from our health department that the main way that this virus is transmitted is from prolonged contact within 6 feet of somebody. So any type of service, anything during which people are closer than 6 feet and don't have face coverings on leads to a severely increased risk for virus transmission. So if you have any more detailed questions about the health metrics behind this, I'll ask that you please do follow up via our outreach email at cityofchicago.org. Had a question that came in related to the health and fitness centers. Is it still allowed to have up to 50 people or 25% in health and fitness centers? Yes, for health and fitness centers, you can still have up to 25% capacity in your location. It's just classes that have no more than 10 people. I'm seeing a couple questions come in related specifically to services provided by physicians' offices, medical services. Now, there are certain medical services that you can still allow to occur where face coverings can be removed. If you can, please submit kind of those specifics to us via email, and we'll follow up with the right authorities in order to provide that exactly right there. So if you have any specific questions related to specific medical procedures, please do send those questions via email. So now I'm going to provide a quick overview of the entirety of the guidelines that are in place for personal services, including questions. I see some questions about capacity. I'm going to review all these that are in effect under phase 4. These are things, so the only change that will be effective this Friday is that services at personal services that require the removal of face coverings will not be allowed. So first, you should be ensuring that all areas allow for 6 feet of social distancing. And if you cannot allow for 6 feet of social distancing, you should be placing impermeable barriers between workstations. And so, for example, if you have workstations that are within 3 or 4 feet of each other, you can place impermeable barriers between them. You cannot or are not placing impermeable barriers between them, you should be providing, you should be decommissioning those places. Yeah, great. You should be encouraging, again, any checkout counters, things like that, encouraging the use of impermeable barriers. Capacity should be limited to no more than 25% for all establishments. And while this isn't necessarily applicable to personal services, any potential gathering that you might have and choke points, things like that, should be limited to no more than 50 individuals. So again, capacity, that does not include staff. So capacity for your clients, your customers should be limited to no more than 25%. Protective gear should be worn by all employees and customers. Face coverings worn over the nose and the mouth. And again, this is the key change effective Friday. Any service that requires the removal of face coverings is not allowed. One point, I see a couple questions come in regarding makeup artists. Makeup artists do fall under this. I do want to make one point clear related to a couple questions that come in. There will be limited exceptions to this for makeup artists or things like that if the personal service is provided outdoors. So again, and related to a couple questions that come in, if the personal service can be done outdoors, then you can, for a limited period of time, for limited exceptions, then you can remove the face covering. So for example, makeup artists that may be doing a wedding, for example, if you can provide the portion of it that requires the removal of a face covering, if you can do that outdoors, then that would be allowed for a very short period of time for a very limited exception. But in order to do that, you need to make clear that the person providing that service is fully aware of the risk. So the person providing that service should be wearing full PPE and should be fully aware of the risk. Additionally, for the client for whom the service is being provided to, you should be checking and making sure that they do not have any symptoms, that they have not traveled to any hot spots, and that they have not been exposed to anybody with COVID-19. So again, the only exception is if that personal service is provided for a very short period of time and is being provided outdoors. That is the only exception that can, in limited circumstances, allow for the removal of face coverings. You should be providing sanitizing products for customer use. Your employees should be washing hands before and after every service. Every product that's handled should be sanitized after each customer, and you should be eliminating any samples, testers, things like that. And then you should be also providing training to your employees, proper hygiene, etc. You should be implementing a screening measure for both your employees and customers. So at minimum, you should be screening you should be having your employees self-screen to ensure that they do not have any symptoms. And they should not be reporting if they're exhibiting symptoms or feeling ill. You can do more. You can do temperature checks. You can do things like that, but at minimum, you should be doing a self-screen. You should be posting a pledge upon the entrance or conducting a screening to verify that your customers are not exhibiting COVID-19 symptoms. Again, we encourage temperature checks. We encourage screenings. At minimum, you should be posting a pledge upon your entrance saying something along the lines of, I will not enter this facility unless I have, or by entering this facility, I am saying that I do not have COVID-19 symptoms. High-touch areas should be disinfected after each customer. Frequently, all high-touch surfaces at least every 2 hours. Equipment should be disinfected and sanitized after each client. If you have any self-serve food or drink stations, they can be open, provided that the employee is the one serving the food and that employee is wearing proper PPE. You should have visual guidance posted throughout your facility. You can find that guidance, and I'll type it in here. Questions related to food and drink stations. Yes, face covering can be removed in order to consume food or drink. However, anytime food or drink is being consumed, you must be following the food service guidelines, which ensure that people are 6 feet away. So you cannot be, while face coverings can be removed in order to eat or drink, you cannot have somebody be within 6 feet of that person while they are eating or drinking. You should be impossible increasing airflow indoors, opening windows, things like that, according to the CDC guidelines. You should be minimizing in-person interactions where possible. Obviously, personal services need to be provided in person, but anytime that you can be doing something remotely or virtually, we encourage that you do so. Online trainings, virtual staff meetings, things like that. You should encourage contactless payment, self-serve checkout where possible. You should only be having one client per employee without scheduled overlap. And walk-ins are allowed. We still encourage reservations. That's definitely something that is better to minimize overlap. Walk-ins can be allowed. They can wait for an appointment in an establishment, but they must be social distancing. You should also be limiting travel for business. So if you have multiple facilities, you should make sure your employees are only working at one of those facilities as much as possible. The less people you interact with, the better. The more we can do to bring down the community spread of the virus. And then you should be following the health department and the Centers for Disease Control and Prevention guidance for testing and tracing protocols. You should be prepared for the reality that one of your employees may contract COVID-19. And if you do, you should follow all the CDC guidelines before returning to work. If someone has had close contact with anybody who's diagnosed with COVID-19, they should self-quarantine. And if you become aware of 2 or more cases possibly associated with an establishment over a 2-week period, you're encouraged to report that to CDPH, to the health department. Additionally, for personal services, you should be keeping a log for each customer with the name, contact information, and service provider for at least 60 days. Great, so that's an overview of the guidelines for personal services. If you've not visited it already, I recommend that everybody visit chicago.gov/reopening. See a couple questions coming in. Hot tubs, saunas, steam rooms. Those should be closed still as part of phase 4. that you can find more information under the Health and Fitness Center's guidelines, but ancillary accommodations such as those hot tubs, saunas, steam rooms, they should be closed under phase 4. Again, that's something that's the same as you'll see kind of at other state and Cook County guidelines as well. Again, I see a couple questions related to specific medical procedures. I ask if you can to please submit those via email, and I will make sure to get those answers to you as soon as possible. Great. Let me move on to a couple more slides, and then I will open it up for a couple more questions. First, enforcement. I just want to be clear to everybody that this is something that BACP, my department, and the health department has been and will continue to enforce. We're responding to complaints. We're also proactively visiting businesses as needed. Now, our focus is on education, and our focus will continue to be on education. But if need be, we will issue citations. We'll also close down businesses if needed. As of this past Monday, we've conducted over 600 investigations of businesses. Since reopening began on June 3rd, we've cited 36 businesses. Each citation can lead to a fine of up to $10,000, and we have immediately closed 2 businesses. Now, to be fair, I think having cited only 36 businesses shows that most people are following the rules. But we do want to make it clear that these guidelines, we call them guidelines, but they are requirements, and they will be enforced. Finally, I wanted to take a minute to provide a quick overview of some other business updates. One thing that I am excited to announce is that as of yesterday, we have passed an ordinance that extends all City of Chicago business licenses that have expired or will expire during the COVID-19 pandemic. So any license that expires between March 15th and September 30th of this year will be extended and will not need to be renewed, and it can be renewed without paying a late fee until October 30th, 2020. Now, I know a lot of personal services do not have a City of Chicago license, but I know that some do. And if you do have a City of Chicago license, and for example, it was set to expire August 15th, you do not need to renew by then. You will have until October 30th, 2020 to renew. Also, I want to make sure that you are all up to date on the latest information on the emergency travel order. Now, this is something that, if you have any questions about it, please reach out and I'll get you in touch with folks from the health department to talk about it. But please visit chicago.gov/coronavirus. Chicago.gov/coronavirus for the latest information on the emergency travel order. As of tomorrow, Kansas has been added to the list for which travelers must quarantine upon returning to the City of Chicago. But please, if you have any questions on it, while we're not the experts, I'll make sure to help get you answers. Please email us at bacpoutreach@cityofchicago.org. Now I'm going to open up. We have a couple minutes left. Again, for a couple of the things that I pointed you to, if I did not answer your question, if you have any questions that's more about the health metrics and data, to please email us at bacpoutreach@cityofchicago.org. But I will open it up for a couple questions. So a question, can shower rooms be used by clients? Yes, shower rooms can, locker rooms, things like that can be used by clients, provided that you are frequently cleaning and disinfecting them. Okay. Massages cannot be, I had a question about massages. So massages do fall under the personal services guidelines. So under this guideline, massages can be performed, but face coverings must be worn at all times during those services. Again, I just want to remind folks, if you have specific questions about medical procedures and whether they count under this, that's something I will need to check with our health department about, and would love to provide a specific response to that. So please do follow up with an email for that question. And then also, again, I see a couple specific questions coming in related to the health data about outbreaks, things like that. I do want to make sure that you're getting specific answers to that from our health department. So please reach out via email and I will get you an answer to that question. In closing, I just want to remind everybody the only change to the phase 4 guidelines that will be coming into effect tomorrow for personal services is that face coverings must be worn at all times and cannot be removed. Now, I'd love to be able to say that this is in effect for 2 weeks, this is in effect for a month. But the fact is, this is entirely and 100% based on the data. And if we see, and the intention of this and the intention of those other requirements that have been put in place is to make sure that cases begin to go back down. And if cases begin to go back down, I recommend that you all visit the COVID dashboard. Again, I'll type that in. If cases do go down, we will certainly consider rolling back this extra requirement. But it's all about what the data says. And if we see, I would recommend, that 200 number is a good threshold. Once we go under 200, that does not mean we will be immediately back to what the requirements were before. But that is kind of the number that the health department has been using. So if we see cases begin to go down, we will certainly consider rolling back this extra restriction. But I thank you all for the time. I know this isn't great news for many of you, but we appreciate your dedication and diligence to keep our community safe. One final question that just came in. Capacity is still 25% for personal services. That is not changing at this point. Again, anything that wasn't answered, any question that you just thought of, please do not hesitate to reach out and we'll follow up as soon as possible. BACP outreach at cityofchicago.org. Thank you all very much for your time. Again, do not hesitate to follow up with any questions.